Good morning. So I was going to go over another piece of research that hopefully will be encouraging to my patients and a help to other folks. It's titled Treatment of Patients with Low Back Pain, a Comparison of Physical Therapy and Chiropractic Manipulation from February 24th, 2020. Now, before I jump into this, my intent here is not to pit the two professions, physical therapy and chiropractic, and proclaim one the victor. I've used physical therapy myself plenty of times. There is overlap between two professions. My main intention of sharing this is to show that there can't possibly be complete overlap. A lot of folks feel like if they're seeing a chiropractor, then why worry about a physical therapist? And many people think, hey, I'm going to the physical therapist, why go to the chiropractor? So for those of you who are my patients or potential patients, I'm sharing this to demonstrate there must be a difference between the two, and in the case of this research, it points out a tremendous difference, an important difference, I should say. So they state the purpose of the study is to investigate the cost effectiveness of chiropractic versus PT in the US within 6 months of treatment and follow-up. And so that main point I was talking about isn't the cost effective part, but they will address that in here. Subjects were men and women 18 to 60 years old, had to have low back pain for over 3 weeks. 55% went to the chiropractor and 45% went to the physical therapy. The article focuses on the effects of treatment as related to sick leave days and the duration of sick leave for chiropractic and physical therapy. So it emphasizes, like so many studies, that low back pain is essentially a pandemic, very costly. Makes the point that the earlier you get help for low back pain with both physical therapy and DC, you're going to avoid higher costs and treatments like shots and surgeries that are much more expensive. Of note, low back pain is the chief cause of years lost to disability in the world. It's the second most common reason that people show up at their primary care physicians. The burden of chronic back pain leads to lower productivity, lower quality of life, higher financial liability for society in general. So they make the point that the entry-level non-steroidal anti-inflammatories are often recommended, but it makes the point that drug care management does not heal patients, and therefore non-pharmacologic therapies, including chiropractic and physical therapy, are recommended. So, important point, the overall number of visits within 6 months for the physical therapy group was 20% higher than the chiropractic group. And that's something I don't think a lot of people know. And most importantly, the findings showed that the total average cost in the chiropractic group was lower than physical therapy, and most importantly, the daily adjusted life years in the chiropractic group was higher than physical therapy. So that's just a fancy way of saying quality of life, future flare-ups, the ability to do what you want to do was found to be higher in the chiropractic group. And we can be confident, and we've seen certain studies that show if you do both, that number gets even better. So, importantly, chiropractic in this time of high healthcare costs as far even legislators on down, it's important to know chiropractic is cost effective. You shouldn't be squeezing chiropractic care out of insurance plans. You should be including it if saving money is really the objective. And it looks like, obviously, when the health of patients and the public is concerned, it looks like there's certainly differences between chiropractic and physical therapy in outcome, and most importantly, the outcome and quality of life down the road. So be encouraged if you're going to the chiropractor. You are getting something different than physical therapy and different than anything else. And hopefully this is encouragement to you. Have a good one.